Two-phase orthodontic treatment is a specialized orthodontic process that encompasses jaw, facial changes, and tooth straightening. Two-phase orthodontic treatment is exactly that, treatment that requires two separate phases. The first phase ideally occurs at an early age in children between the ages of 7 and 10, while the patient's jaws are flexible and their growth potential is still at a maximum. The first phase of treatment usually lasts from between 4 to 12 months. After the first phase, the child is monitored and the decision as to the need for a second phase is made. Phase 1 care is intercepting an orthodontic problem before it gets out of hand. The idea is to shift teeth, manipulate growth, create space for uninterrupted teeth, break habits, and prevent trauma before it is too late. Most children will require a second, more comprehensive phase of treatment after they mature in order to create a completely stable, functional, and aesthetic smile. Second phase treatment begins once most of the adult teeth have erupted. This phase usually requires 12 months with braces on all of the teeth. After the second phase of treatment, retainers will be worn in order to hold the teeth in correct position. The major advantage of two-phase treatment is to maximize the opportunity to accomplish the ideal healthy, functional, aesthetic, and comfortable result that will remain stable. In some cases, interceptive or phase 1 treatment will avoid the necessity for tooth extractions or major jaw surgery as an adult, as well as having psychological benefits for younger children by improving their smiles. Elastics are essentially rubber bands that are attached to brackets or hooks, usually between upper and lower or front and back teeth, applying tension and causing teeth to move. Elastics can be used in many ways depending upon the treatment objectives. Your teeth and jaws may be tender the first few days of wearing elastics. This is normal and should begin to disappear within a week. Some patients report that rinsing with warm salt water helps reduce orthodontic discomfort. If soreness persists, please call our office. It may be awkward for you to put on the elastics at first, however, it will become easier with practice. You may remove the elastics only when brushing your teeth. Leave them in during meals and be sure to replace the elastics with new ones in the morning and at night before bedtime. After a while, elastics lose their strength. If one elastic breaks, replace both sides. Wear your elastics as instructed to prevent any delay in treatment. Carry extra elastics with you at all times. If you don't have enough to last until your next appointment, please call us and we can send you more. We do not want you to run out. Before you leave the office, be absolutely sure you understand exactly where to place the elastics. Hooking them on incorrectly can be worse than not wearing them at all. Elastic wear is an important key to the speed of your treatment and the final results that we can achieve. Please call us if you have any questions or concerns. Even though you have taken care of your orthodontic appliances, you may occasionally damage them. Eating, participating in active sports, or even going through your daily routine, you may experience some difficulties. Loose band or bracket, broken arch wires, loose wires, poking wires, lost tie wire or elastic, soreness, headgear not fitting, and accidents involving teeth are all possibilities. If a band or bracket comes loose from a tooth, call our office for an appointment. While a tight band or bracket actually protects a tooth from decay, a loose band or bracket is extremely dangerous and decay can occur under it. If the band or bracket is still attached to a wire, leave it in place and apply wax if you are experiencing discomfort. If the band or bracket comes completely out, place it in an envelope and call for an appointment. If a main arch wire breaks, the one that goes all the way around the outside of your braces, call our office for an appointment. Should a wire come loose, try to place the wire back in the tube. Place wax if there is any discomfort and call for an appointment. Sometimes a poking wire can be safely turned down so that it no longer causes you discomfort. If you are unable to take care of a poking wire, apply wax and call our office for an appointment. A lost tie wire or elastic tie is not necessarily an emergency. Call our office to schedule an appointment to replace it. Soreness during treatment is to be expected. Warm saltwater rinses and Advil or Tylenol are helpful in relieving soreness. On occasion, the headgear does not fit. Sometimes this is caused from not wearing your headgear as it is prescribed. If the face bow has been bent or if the band holding the headgear is loose, do not wear the headgear. Call for an appointment. Should you experience an accident involving your teeth, contact our office immediately or contact your general dentist. Please remember, if you are involved in contact sports, a mouthguard must be fitted over your braces for added protection. An expander is for patients whose upper jaw is narrow. It gently widens the upper arch by stretching the center palatal connective suture. The expander is prescribed only prior to completion of growth. A parent or the patient should adjust the expander daily as instructed until the palate has been widened to the desired position. It is then left in place for approximately 4 months without further adjustment while new bone fills in the center palatal suture or healing occurs. Expect to see a space appear between your upper 2 front teeth as the palate is widened. Before the expander feels comfortable, you may sense some initial pressure and expect to feel a tingling or itch under the appliance. You may also feel a tingling sensation across the bridge of the nose or feel pressure in the cheek area. A special key is used to activate the expander. Insert the key in its slot. It will not touch the roof of your mouth. Next, push the key all the way from front to back. Then remove the key. Typically, you will rotate the screw in the expander to the point where you can see the next slot or hole. This demonstration shows the results of an expander over time. Your expander should be cleaned on a regular basis with cool water, toothpaste, and toothbrush. If your appliance is cemented in, brush it as you would your teeth, paying attention to the bands that hold it in. Brush gently along the gum line to remove the plaque. If your appliance is like a retainer, take it out of your mouth and brush it with the same brush and toothpaste as you would your teeth. Plaque sticks to plastic better than teeth, so extra brushing is important, especially where the wires join the plastic. Brush often, at least 3 times a day for 2 minutes at a time. Call our office for an appointment if a band feels loose, you think the appliance needs to be checked, you need advice, or you experience unusual symptoms. After expansion of the palate, you will be ready for braces or other appliances to complete orthodontic treatment. The extraction of teeth for the purpose of achieving a more aesthetic and functional smile is an option that may be appropriate for children, adolescents, or adults. The extraction of permanent teeth in adolescents and adults typically involves, but is not limited to, cases of severe crowding, cases of protruding teeth, and cases in which the position of the jaw or jaws are in a state of misalignment. Your orthodontist will refer you back to your general dentist or an oral surgeon should extractions be necessary. Serial extraction is the sequential extraction of primary or baby teeth followed by the extraction of permanent or adult teeth. By removing the primary teeth early, the permanent teeth erupt sooner and can be removed to allow room for neighboring teeth to emerge. The sequential removal of baby teeth can dramatically improve a severely crowded problem. Serial extractions are usually followed by comprehensive orthodontic treatment once the permanent teeth emerge. The proper extraction of teeth combined with orthodontic treatment will generate an excellent functional bite and a pleasing profile. Serial extraction may also prevent the impaction of permanent teeth or the eruption of teeth into an undesirable position. The impaction of canines is a typical result of retained primary teeth. These cases involve primary teeth that do not fall out on their own, causing permanent teeth to take an alternative path of emergence. In the traditional extraction treatment of patients with permanent teeth, braces are applied by the orthodontist prior to extractions. This prevents the remaining teeth from drifting out of position. Your teeth are secured in place by their roots, anchored in a soft, malleable gum and bone mass. After extractions, braces or other orthodontic appliances are used to close the newly formed spaces. Extracted teeth may cause a change in facial profile. This change may range from slight to significant. This is part of the orthodontic treatment plan. In more severe cases, a combination of extraction and orthodontic surgery may be required. Class 2 malocclusions, often described as buck teeth or an overbite, are a condition where all the upper teeth are forward relative to the lower teeth. There are many treatment options available to correct a Class 2 problem, including the use of headgear, elastics, extractions, jaw surgery, and lower jaw positioning with devices such as a Herbst appliance and now with the Forsu appliance. The Forsu is an innovative and exciting new alternative in correcting a Class 2 bite. It looks somewhat similar to the Herbst, however, there are many inherent advantages in treatment with the Forsu. It is far more comfortable, it is more discreet, it is easier to maintain, and it is twice as fast in achieving the intended clinical results. Most importantly, treatment results are more predictable and precise. The Forsu will usually correct Class 2 problems in 4 to 6 months compared to the 12 to 18 months required for elastics. This equates to fewer and shorter appointment times in our office. And considering that it is a fixed appliance, an appliance that remains in the mouth throughout treatment, patients no longer need to remember to wear and regularly change their elastics. Extractions and surgery can oftentimes be avoided when utilizing the Forsu. The Forsu appliance connects to the upper back and lower middle teeth. Our patients are amazed that it hardly shows at all. It moves as the mouth moves and permits normal eating and speaking because the springs are gentle in moving the lower jaw forward. After the Forsu is removed, elastics are usually needed for only a short period of time before the braces are removed. Brush your teeth at least twice a day for approximately 3 to 4 minutes. Clean your teeth, especially in areas between your teeth, gums, and the appliance. Preferably take a toothbrush with you during the day to clean or at least have a rinse after every meal if you cannot brush. If possible, floss between your teeth and gums and in the areas around the Forsu appliance as well. Rinse daily with a fluoride mouthwash. If you should experience a problem with your Forsu appliance, don't panic. Go to a mirror, open your mouth very wide, and use your fingers to reconnect or disconnect any loose parts and call our office immediately. Braces are the most common appliances utilized in orthodontic treatment. Only after a comprehensive orthodontic examination, including diagnostic records, are braces placed. There are many varied types of brackets and wire systems utilized in orthodontics. Each has specific characteristics to achieve a predetermined treatment goal. And just as there are many different types of braces, there are just as many varied philosophies or techniques practiced. Typically, the first step in the application of braces is the placement of molar bands, when and if it is determined that bands are indeed necessary. Molar bands require a space between the molars to allow the bands to be applied. If there is not enough space available, the space is created with spacers, which are small, flexible rings resembling small rubber bands. These spacers are placed between the molars to gently move the teeth to create the space necessary to slip the band over the tooth. This may take a few days to achieve. Once the proper space is achieved, the molar bands are fitted for size and seated into position. Cheek expanders and a tongue suppression device are placed in the mouth to create the space necessary to manage and place the remaining appliances. Next, the teeth are then thoroughly cleaned to remove any plaque or debris to help assure secure bonding. Once cleaned, you will be asked to thoroughly rinse your mouth. An etching material is then applied to the surface of each tooth. This prepares the surface of your teeth for the bonding agent that will hold the braces in position during treatment. A primer or sealer is then applied similarly to the etching material. This primer will react with a composite or bonding agent, which is then applied to activate the adhesives. Brackets are placed tooth by tooth in exacting position. Each can be measured to assure proper positioning. In most cases, the slot of the bracket is measured from the bottom edge of the tooth on each tooth. Next, a high-powered but safe curing light is utilized to activate and harden the adhesive to secure the bracket to the teeth. Some bracket types are pre-coated with the bonding agent already in place. Lastly, an arch wire is placed in the brackets and secured. Today's arch wires are made of special metal material that creates force to move the brackets as the wire tries to achieve a perfect arch. Your braces will go to work immediately. Be sure to follow all of the guidelines and instructions for care of your new braces, as patient compliance is a critical component to a successful outcome. Headgear is a very important part of your orthodontic treatment. The more you wear it, the faster we can correct your orthodontic problem. If you choose not to wear your headgear as instructed, it simply will not work. Your teeth won't move properly, and wearing braces could be a waste of time and money. The metal part of the headgear fits into the little round tubes on your bands on your upper back teeth. Make sure that when you slide the headgear in, that it goes all the way in on both sides before you hook the strap. Also make sure that you have put it in right side up. Then hook the strap on, making sure to use the correct holes. Using holes that are tighter or looser than those which you were instructed to use will change the way the headgear works and might make your teeth move the wrong way. As long as you keep wearing your headgear every night, the initial soreness will disappear. It is still working even if it doesn't make your teeth sore. You do not need to wear the headgear to school, work, or during active sports. However, it must be worn at least 14 hours each day unless otherwise instructed. Consistent daily use is essential to achieve success in treatment results. You may want to keep a record of wear. When wearing headgear, expect to feel some pressure when the strap is attached to the face bow and relief of the pressure when the strap is detached. Also, expect your molars to ache and be slightly loosened as tooth movement occurs. Dry, chapped lips and some difficulty in sleeping initially are typical side effects of headgear usage. If you think you have a problem with your headgear, call our office right away. We will have you in to inspect your headgear and make any adjustments that may be needed. If your headgear doesn't fit right, if the dog chewed on it, if one of your bands has come loose from your tooth, even a little loose is bad. If you lose any of the parts, or if the strap or the metal face bow is broken, don't wear your headgear. Call our office and we will schedule an appointment so we can repair it for you. Invisalign is a breakthrough technology now widely utilized in orthodontics. Often referred to as clear, removable braces, Invisalign uses technology that straightens your teeth without wires and brackets. This technology utilizes a series of individually manufactured clear, customized removable appliances called aligners. They are virtually undetectable, which means hardly anyone will know that you are straightening your teeth. Each in this series of aligners is slightly different and progressively calibrated using 3D computer technology to move your teeth into their intended positions. When you wear your clear aligners, your teeth move week by week, millimeter by millimeter. Unlike braces, your aligners can be removed for eating, brushing, and flossing. Invisalign only works while you are wearing the aligners. We recommend that you wear your aligners full-time, day and night, except to eat, drink, brush, and floss your teeth. Because the aligners are designed to sequentially move your teeth, it is very important to wear each aligner in the order prescribed. Usually, you'll wear each aligner in the series for about 2 weeks. Keep your regularly scheduled appointments. This is the only way we can be sure the treatment is progressing as planned. Failure to follow instructions could significantly delay or compromise treatment results. Wash your hands thoroughly with soap and water before handling your aligners. Handle only one aligner at a time. To insert your aligner, make sure you have the proper aligner, the upper for the top teeth and the lower for your bottom teeth. To help avoid confusion, each aligner is engraved with your initials and a U for upper or an L for lower. Insert the lower aligner first, then the upper. When inserting, gently push the aligners over your front teeth. Then apply equal pressure using your fingertips to the tops of your left and right molars until the aligner snaps into place. Do not bite your aligners into position. This may damage them. To remove, using your fingers, simultaneously apply equal downward pressure on the left and right side of the upper aligner and lift the aligner off your rear molars. Lift upward for the lower aligner. Using your fingers, gently lift the aligner off your front teeth. Immediately rinse and store your aligners in the protective case provided with your starter kit. To help prevent damage, avoid unnecessary removal. Do not use any sharp object to remove your aligners. Clean your aligners prior to each insertion. Use of the Invisalign cleaning system is recommended for the effortless extra strength cleaning and clarity that it provides aligners. Rinse well after each cleaning. Do not use denture cleaners to clean aligners and do not soak them in mouthwash. These products can damage the surface of the plastic, causing it to become dull and more visible. Proper oral hygiene while in treatment is critical. Always remove your aligners before meals. Brush your teeth after each meal and prior to reinserting your aligners. Brush and floss according to your usual routine. Regular checkups and cleaning are recommended for the continued health of your teeth and gums. Proper storage of your Invisalign aligners is necessary to assure their safekeeping. 2 aligner cases are included in your starter kit. We recommend that you store your Invisalign aligners in a case when not in your mouth. This will protect them from potential damage. What are mini orthodontic implants and how do they apply to orthodontics? Mini implants are tiny pins that are placed in the mouth by the orthodontist or oral surgeon, which